Hello and welcome to today's episode. I am your host Atul, and today we are diving deep into a topic that's widely talked about but still often misunderstood: ADHD. We see it everywhere now, with more people getting diagnosed with, in adulthood. Conversation about neurodiversity becoming more mainstream, and at the same time, a lot of misconceptions floating around. So, what's real, what's exaggerated, and most importantly, what does ADHD actually feel like for someone living with it? To explore this, I couldn't have asked for a better guest. Joining me today is Ahmadreza Tadrisi, a psychotherapist with an extensive experience in ADHD, stigma, and misdiagnosis. He not only works with individuals but also actively shares insights on these topics. Ahmadreza, it's great to have you here. How are you doing today?
Hello everyone, thank you for having me. It's great to be here, and I hope we can have a great discussion about ADHD.
And I'm really excited for this conversation because I think ADHD is something we hear so much about, yet so many people are still struggling to understand it beyond, I think, just the typical symptoms there. Right. So I want to start by taking this beyond the clinical definitions there, Amrita. We hear ADHD described, I would say, as a disorder of attention, or let's say executive functioning challenge. But for many people, I think ADHD is something much deeper. It's a different way of experiencing life. For you, when did ADHD stop being just a diagnosis and became something personal? Was there a moment that completely shifted your understanding of it?
Yeah, of course. If I want to start very personally about this, it can go back to the time that when I was in high school, and I was one of those gifted students that people were talking about, and somebody that had the best grades in the class and was one of the top students before the time in high school. And so there were, a lot of hopes and dreams about the future and what will I do in university and all that. And somewhere around the starting high school, my performance started to decline. And, nobody had a very clear answer for it. And I was in we have these schools in Iran we call a special school for exceptional talents. So it has a very competitive environment that everyone is basically a
Mhm.
top student, and
Yeah.
they're all studying extensively, and they all have great performances, great grades, and they usually go to top universities. So it's a very brutal environment to be in. And my performance has started to decline in that environment. So, when you are in a situation that everybody is performing very well, if you
Mhm.
start to, show decline and weaknesses, so you become very highlighted in that sort of environment. So that happened, and it got worse and worse every year,
Mhm.
and I didn't have any answer for it. And I remember I used to go to school counselors, and I
Mhm.
even went to a psychiatrist when I was around 18.
Yeah.
And nobody really provided any meaningful answer for all the struggles and symptoms that I was clearly experiencing, and was directly had it was having an impact on my performance, all that. And so that time, passed, and it went into my head that something is wrong probably with me, and I don't have any explanation for it. So I somehow went through college and university with the same struggles, but I was just able to, pass the terms and all those lessons and all that. And yeah, it was a moment somewhere around maybe 10 years ago that I started going to therapy. So going into that therapy still didn't provide the answer for my academic struggles and school struggles, but it somehow helped me to at least making some new decisions for me and trying to change my path a little bit. So I got really interested in the work of a therapist, and I made the decision back in the time that I can, do the same job. So I started to to think about changing my academic field and
Mhm.
starting, to study psychology. So we have an entrance exam. I think the same system. I think something similar is in India as well. So you probably know what I'm talking about. So I had to study for an entrance exam for a master's program in psychology. And somewhere in reading some of those lessons and textbooks, there was something that I noticed in ADHD.
Mhm.
And I was reading the symptoms and all that, and I realized that this feels familiar. Like there are, some experiences and some, situations in life that an ADHD can experience that kind of look similar to what I have been through in the school and my academic struggles and all that. So I started reading more, and I remember there was a book from a famous doctor in this field, Dr. Edward Hallowell, that I bought and read, and the stories were completely similar, almost identical, what happened to me in school. So I can say it began with a self-diagnosis. I knew that, something like this was probably the answer that I was looking for all these years. So later on, I went to a psychiatrist for confirmation, and, it was very clear that this was
Yeah.
the reason I was experiencing all those struggles. And that was probably that time was the most important, turning point in my life. That I was like, something really this important with this magnitude that can have such an impact in your life, in your school performance, in your university, in your, even choosing your job and all that is happening, and the information about it is so low, and a lot of people don't know anything about it, and I was one of them. So this became something like a purpose, like this is like what something this is something that I can do in my life to help people that are going through similar experiences, find something that can provide an explanation, like provide a meaning for all their experiencing, and maybe providing some help that they don't go through all the suffering and pain that I went through, and maybe they can take it a little easier. So that's where I knew what I want to do with my life, and even gave a very good direction for my work in future. So I
Yeah.
started reading. I even went on and worked on my thesis during masters, and now it's like around 4 years that I'm taking on clients and working in this field. And majority of my clients are adult ADHDers. So we try to, make a meaning out of this and helping them to, finish their universities, find a path in their career or job, and, experience a little better in all aspects of life and have a better quality of life. It's not easy, but well, we are
Mm.
trying to do our best.
Absolutely. I think that's really interesting. And first of all, thanks for sharing with us, Ahmadreza, your own personal journey there and how it has shaped you who you are today. And of course, you're doing your best by ensuring that you're able to give in that support to other people that are around you who are struggling probably with the same set of issues. And definitely, when you are in this profession, you obviously work closely with people, which gives you an entirely different perspective. And I can see that now you have a very different perspective there about the whole ADHD spectrum. Um, and I think that brings me to a very important thing, which I do see a lot nowadays, is self-diagnosis. People resonate with ADHD content online and start identifying with the traits, but some find it empowering, but others worry that it might lead people down to wrong path. What is your take on self-diagnosis? Does it help or does it hurt?
Okay, so as you can see, I have a very soft spot for it because I think as I myself experience it in my life, people go for a diagnosis because of a need. So if there isn't a need for, going and searching and exploring for an answer, people don't really like to receive a label like this. Like it's not a fun thing to do, like or going out and saying, telling everybody, oh, look, I have like this, mental disorder or something like that. So when they're doing that and when it's become a trend, when it's become a phenomenon in society, everywhere, basically it's because, people were having these sort of problems, probably most of them, and they started the process from a need. And if they are thinking about it, I think we as mental health professionals should take that more seriously. I'm not saying that basically all people that start from a self-diagnosis position, they are always right. But in my own experience, in my practice, I'm seeing that the majority of them are saying something right about it. So they start from a need and they come out and say, look, I think this is my problem, and we can explore it again from a more professional perspective. And if they're right about it, who am I to say that, look, no, I don't think that this is, the right explanation. So what I am seeing is that I think the process is helpful. Like I myself would have embraced it with open, heart if this would happen like 15 years ago when I was in high school. So I
Yeah.
needed it back in the time. So I take it from a more positive perspective. The current atmosphere that we have right now, like Instagram, TikTok, LinkedIn,
Yeah.
whatever platform that we are seeing, or information circulating around. I understand that not everything is correct. Like there are a lot of misconceptions and a lot of bad information. But this is like the whole story with internet. We have better information and worse information. I think we as mental health professionals should try, should feel responsible and try to provide the better information as much as we can. But I think when people are self-diagnosed, we shouldn't immediately reject them. Like we should give them some space and we should give them the right to explore initially. And we should say, okay, if you are feeling that way, I'm fine with it. Let's explore it from a more professional lens and to see if we can confirm it. That's my stance, but I think not all mental health professionals are taking it this way, and some of them are even very upset about it. I can understand that, but I think at the end of the day, we are the servants of people. We have to
Yeah.
take their needs very seriously. And if they have this need to self-diagnose sometimes, I mean, we should take it seriously. It's fine.
Yeah. I think that's a very good point that you made, Madrasa, because it makes a lot of sense that self-diagnosis does open doors for people to really understand and probably see if there is anything that's going on for them. But it's always good to just reach out to a professional and just to check in if it's really what you're looking at on internet, and finding the right resource or the content is very, very important. And I think that's what we're discussing here. But I also see that a lot of time these traits that we do check, you know, online or through different platforms, if we're going into that self-diagnosis, I think it overlaps with so many other things, such as let's say trauma, anxiety, and it just really makes me think about how much nuance is needed in these conversations. So speaking of these overlaps, ADHD is often treated as a distinct condition. But in reality, I think it shares so much space with anxiety, trauma, even autism. Do you think our current approach to diagnosing ADHD is outdated, or do you think we need a different approach
Um,
there?
it definitely is because even if we look at the DSM symptoms, they are just covering a very limited, set of symptoms in terms of the struggles that you would experience as an ADHDer. And the DSM symptoms itself, they have caused a lot of problems in recent years in terms of diagnosis. Like, for example, in terms of diagnosing ADHD in women, we've had lots of problems. And, I think it doesn't give professionals a very broad perspective for finding people, finding these problems in people. And as you said, we have a lot of overlap. Like you can have ADHD and at the same time you can have like general anxiety disorder. You can have
Yes.
autism spectrum disorder. You can sometimes even have personality disorders like BPD. Like I think 25% have learning disorders. Uh, Around 20% have tic disorders even. So when you have all these comorbidities and you have all these overlapping symptoms, and this the current trend that whether it's trauma or ADHD or one of these are causing the other,
Yeah.
it's a very complicated and complex matter. And I think the highest level of nuance is needed for making a diagnosis. And I would even say that sometimes have to check for the physical condition of the body as well.
Yes.
Like we as psychologists don't take this too seriously, but I think sometimes we see that we may have to check for blood tests and see, like, for example, the thyroid is working well, or is there a history of brain traumatic injury or something like that. These are things that aren't there right now, and we don't see a clear guideline, like we don't see anything on DSM about this. But I think there should be more conversations about all these and all the nuance and complicated matters that we have. And we know that ADHD can have, I would say, a core feature in problems. Like when you are experiencing ADHD, you might experience other conditions because of ADHD. Like you can experience anxiety, you can experience depression. We even have this understanding that ADHD makes you more susceptible to experiencing traumas because of the emotional sensitivity that you might have since like being a very young kid. But if we as professionals feel more responsible about this and read more about this, I think it's not something that is impossible to find solutions for. But one problem that we have is that we don't have a really good guideline. And another problem that we have that I think is a little serious problem is that some of the mental health professionals don't even believe in such diagnosis. So they view it as something like a religion. Like they don't even believe in the DSM diagnosis and something like that.
Yeah.
And I've had many patients, several patients, that they have had experience of going to therapists before, and their therapists don't believe in such diagnosis. So they're experiencing all these symptoms and they're experiencing all these struggles. But because those therapists didn't believe in such diagnosis, they wouldn't provide any clear answer. And we see these sort of problems with approaches like, classic psychodynamic therapies or maybe some existential ones. And when we have such problems inside the field, it's hard to be able to help as much as we can from the outside. So these are all complicated matters and problems that we are experiencing right now. And I think that's why we need more conversations like everywhere.
Yeah. Now, when you talk about it, I definitely feel that it's quite late there, and I think that's why so many people, go undiagnosed or misdiagnosed for years. Uh, and it's very fascinating to also see how we need a very comprehensive approach here because of the overlaps and everything that's out there. Because I think ADHD doesn't exist in isolation. And when we separate it
Yeah.
too much from other conditions, we sometimes might, miss the bigger picture there. So I think a comprehensive outlook and approach is very, very important um, if we look at this.
Yeah, we have even a number from research that is saying around 80% of people who have ADHD probably has another mental condition as well. So
Yeah,
80% is almost, the majority. So when you're
yeah,
looking for ADHD, you definitely have to look for other things as well. And this is actually one of the reasons that
mm,
ADHD is missed a lot of times when
yeah,
people go to professionals. Like when you go to a mental health professional, whether it's a psychologist or a psychiatrist, for
mm,
example, you have problems with your sleep, you have
mm,
problems with your anxiety, or you're experiencing, for example, depressive episodes, or even you've had traumatic events in your life. So they saw these, they're seeing these events in the surface, and they're
mm,
trying to, heal those symptoms from the beginning, and they somehow, miss the fact that there is maybe another underlying factor behind this, behind the surface that I'm seeing. So this is why a lot of times the diagnosis is missed, and this is one of the aspects of that nuance thing that I think professionals should take more into account, because overlap happens, comorbidity happens a lot, and it's way more common in ADHD than you can ever imagine.
yeah. I think that brings me to a very important question, Ahmadreza, and you must have seen a lot of clients that you've come across that many adults only get diagnosed with ADHD later in life, right? How do you think that impacts their sense of self, and what challenges comes with, let's say, unlearning years of masking and coping?
I'm sorry, I missed the first part of your question. Your sound stopped a little bit.
Right.
Can you repeat it from the beginning? Sorry.
Sure. Sure. I was just saying that, many adults only get diagnosed with ADHD later in life, right? So I just wanting to understand
Okay.
how does that impact their sense of self, and what challenges comes with all of these unlearning years of masking and coping.
Yeah. One common thing that I see in adults that were undiagnosed for years is a feeling or a sense of being an unaccomplished person. Like they have gone through school, they have gone through university a lot of times, but they're feeling like I haven't had that much accomplishments in my life that I was feeling I could have, like there is this gap
Mm,
between my potential as a self or my ideal self and the real self that I am experiencing today. So I think because ADHD directly impacts your performance in daily life, and it causes daily struggles in terms of accomplishing tasks or doing what's immediately important. I think in the long term, it can cause a sense of like feeling lost, like or even being in deep shame in terms of who you are. Because what we see in many ADHDers is that when they're in school, everybody is talking about them as a gifted person because they
mm,
were very creative, or like they
yeah.
were seeing things that others couldn't see. So when they come out and then they reach adulthood, like others are starting to notice that this gifted kid hasn't really, reached somewhere in life. So this gives them
Mm,
deep shame and deep sense of, being lost. And a lot of times, I think many ADHDers are searching for an identity even when
mm,
they have, reached adulthood. Like they are sometimes even 30 years old, 40 years old, but they still feel that they don't have a sense of a stable self or a stable identity that they would
yeah.
they would like to have till now. And this is actually one of the core problems that usually they have to work on. when clients come and receive a diagnosis, because they feel like they finally, they're receiving an explanation, an answer for their problems, and they have to start, searching for the final answer. That who am I? Like, what should I do with my life, and what would be the accomplishment that I could really do right now and would make me satisfied, from myself and for the life in general. And it's quite challenging because, especially when you have reached adulthood, like you've gone through some years and you always feel that maybe I can't go back into time and, recover for these last years and all that. So this is why I think early diagnosis matters a lot. So as early as you can, if you can identify the problem, if you can help the person, you would find it a little bit easier to help them with this matter, like being felt lost and have this shame and have this, sense of lost identity that people experience, especially as adults. But I think in another form we have this expression in Persian that we say, whenever you take the fish from the water, it's never too late. So I think at the end of the day, no matter, what age you have, it's still better to receive the diagnosis than,
Yeah.
the condition that you went on with your life undiagnosed and you experience the same problems and feelings like being felt unaccomplished and sense of loss and all the shame. So even if you've reached an older age, even if you're beyond 50 or all that, still, if you find a chance to receive diagnosis, it's still better because from that moment, you can start to, shape up your life and experience things in at a better form that you would like to do. But yeah, we have all these struggles, and it's like I think a war within the self when you're undiagnosed because you don't have answer for some of your deep questions. And the funny thing is that the moment that you receive the diagnosis, the war is over because you can start to, find all the answers for the questions that you have. And from one moment, from a period, you can experience peace with yourself. And that's, I think, healing will start to happen.
That's such a powerful point there, right? I think, diagnosed as an adult is an emotional process. It just explains so much, but it also makes people rethink their entire past, their entire sense of self. And I myself have seen so many clients go through this journey, and it's a lot to process sometimes for people who get diagnosed later. But early, the better is, of course, always. Um, but as we talk about this, I think there's a lot of debate about the best way to manage ADHD. Some people swear by medication, some people prefer going to therapy, some people, focus on lifestyle changes. Do you think treatment should be more personalized rather than following a very standard approach?
Yeah, I'm actually always for a person-centered approach when it comes
Mm,
to treatment and therapy. And I think we should, define what would work best based on each individual. So, because everyone has their unique story and has their unique preferences, and we see that even bodies respond differently to different
yes.
treatments. So that's why it matters a lot that, we tailor a very individual treatment plan for each person. And we know that, the first line of treatment is medication, but I don't think every person, would need medication if they want to manage ADHD. Medication is for cases that whether in one scenario the ADHD symptoms itself they are very severe, can happen for some individuals, or you are in a very critical stage in your life that you can use some outside help. And for example, one example is those entrance exams that we have in our countries. For example,
mm,
if you have ADHD and you're going through an entrance exam, that it feels like a marathon, like you have to study for 1 year. It might be hard to
yeah,
manage yourself daily for a long time. So in that
mm,
case, for example, medication can help. But
mm,
for others, maybe if you are already doing some aspects of your life fine, you
mm,
might, for example, just need a therapy or coaching, uh, or maybe some modifications in your lifestyle and stuff like that. You can
mm,
manage ADHD very much fine. So
mm,
I myself never, I've done medication and I've had my fair share of struggles, but I've, ended up pretty much fine, and I think it has worked well for me. But I would never assume that it should be the same for everybody. So I think even for my clients, I always say
mm,
that you have to make this decision for yourself. Like it's like a choice. If you
mm,
choose to take medication, it's totally fine. You shouldn't feel ashamed because you're feeling that you might need extra help, and it's completely normal. Other clients that say, no, I want to, take this journey without using meds, I say, okay, that's fine too. And I will help you as much as I can to find, solutions that, can work based on your unique life experiences. And this is the maybe most important point, even for, the therapeutic solutions that
mm,
are without medication. uh, there should be still an individualized, aspect based on every
mm,
individual, because for some people you see that one solution works, but
mm,
for other people you see that the same solution can work for them. So it
mm,
really, for if you're a therapist or if you're a coach or a counselor, it really
yeah,
matters that you take direct feedback from the client and tailor something, customized version that that person themselves can experience, that they can, work with those solutions well, and it can, give good responses in their life. And if it
mm,
works for them, then that's fine. But if something works for somebody, that doesn't mean that it's going to work for everybody
mm,
else. That's, I think, one of the main problems that we have right now. So I'm
yeah,
seeing it every day, for example, on LinkedIn, that somebody, for example, somebody is taking a cold shower and is saying that I'm managing my whole ADHD with just taking cold showers. I'm saying, okay, that's
yeah,
fine. It's working for you, and I
yeah,
don't have a problem with that. But I think we are not entitled to come
mm,
out and say that, okay, I am doing cold showers and I'm doing fine. So all other ADHDers should just take cold showers and all the problems will eradicate. That's a very dangerous message, I guess.
yeah. I think that makes so much sense because everyone's experience with ADHD is so different. It's not a one size fits all situation, right? I think people need options and flexibility in how they manage it. So it works very different for everyone there. So it needs to be very personalized and customized, is
Yeah,
what I'm
exactly.
understanding, right? Um, but when we look at, because
Yeah.
you mentioned a few minutes back about the shame, right? That when they're diagnosed later in life, there's a lot of shame
Mhm.
that they carry. What does this shame look like specifically in clients who are diagnosed later? And also, how do we, as mental health professionals, work with the shame that the client shows up in therapy space?
One important thing about it is that a lot of times we see that shame starts to come out to come from the outside environment. Like, for example, it can come from the parents of ADHDers. Like, they don't know why some sort of behaviors is happening, so they start to, become very, like a saboteur, or being very reprimanding in terms of behavior, and start to, negatively always punishing them for the behaviors that they show and manifest, especially when they're younger. So for a young kid, this is a very, heavy and negative experience. So when you're repetitively failing at something, and when you're receiving negative feedback from your outside environment, like your parents, which are your, most significant relationships early in life. So you
Yeah.
start to internalize that negative feelings inside. So you start to say, okay, so maybe deep down something is, very wrong with me. And that's a start to, make that feeling of shame and shaping it with
Yeah.
different forms of, shapes throughout life. And when you reach adulthood, you might not have that negative feedback from the outside anymore, but because of, that heavy internalization that you've done throughout these years, now you would, self-inflict this wound upon yourself whenever you're in a situation. And for example, when you experience failure, this shame can massively rise inside you, and you're, again repeating those internal dialogues that, okay, maybe I'm not a, good person, I'm not enough, or maybe I'm unaccomplished, and I've experienced all these failures, and this just proves that maybe I'm a failed person
Yeah.
after all. And this might be one of the reasons that actually people might even stopping themselves from receiving help from outside. And I'm not only talking about therapy. This can even mean that receiving help from your friends or your partner or your immediate relationships that you have in your life. Because, when you're feeling that sort of deep shame inside, you might feel that nothing would probably work, so what's the point of going out and talking about my struggles and problems and receiving help for it. And it can happen for both men and women in different forms. I think men, we see a pattern, something like this, that they think they always have to take everything single-handedly. So they feel the responsibility is all on them. So they should never, come out and share about their emotions, share about their feelings, and they feel like they're all alone in this world, and nobody's really there to be able to help them. For women, it goes in another way. They a lot of times, throughout their life, uh, they're always learning to mask their symptoms, because everybody is expecting them to be the good girl in the environment. So when they reach adulthood, they're like, okay, so this is like my role in society. And if in any sort of way, or, I start to, causing any paradox with that role, then I'm becoming the bad one. So I have to maintain that, good girl image that everybody was expecting from me. So this is why I think we are seeing these trends, especially in women, that they're all coming out and saying that, okay, I was masking my symptoms for years. And well, funny thing is that we are seeing this trend as well, that there is a very high degree of comorbidity between ADHD and ASD, the autism spectrum. And I think that can you know, add to that feelings of shame when we have autism as well. Because when you have autism, you probably experience direct problems in your social interactions when you are a very young kid.
Yeah.
So you're simultaneously experiencing personal problems in terms of performance and in your relationships. So you're receiving two channels of shame emotions from different aspects of your life. So when you reach adulthood, you probably feel like a failure from all aspects, from all directions. So it's really important to be able to identify the core underlying reasons behind this behavior. And today we know that, okay, when we are seeing ADHD, now we have to check for other conditions as well, like autism or maybe learning disorders, or sometimes we even see the simultaneous anxiety or even depression that we can experience as an adult. So the more that we can identify these underlying reasons, the more we are able to address the shame feeling that the individual was experiencing throughout their life. It's quite challenging, but I think this is our best chance right now. I think we are living in a very good time in terms of all the information that we have. Like one clarifying thing that I learned on LinkedIn was that till 2008, it was forbidden to diagnose adults in ADHD in a country like England. Like I'm not talking about like a third world country or somewhere
Yeah,
that the information was low. These are the first world countries. So we are living in a good time. Like people that are experiencing these problems have the best chance more than ever to receive help, to receive treatment. But I think there will be a lot of time from now that we can, work on this shame and uh, you know, help the society to understand all these problems better, all these conditions better, so that we can, decrease the overall shame that we are experiencing as a society in general. There is much
yeah,
work to do, but at least we have a better chance to address it right now.
yeah, yeah. And it makes a lot of sense that it's not just the internal shame, but there's a lot of external shame out there also in Ahmadreza, right? How do you see society's perception of ADHD, let's say, contributing to the feelings of shame? Do you think there's this sense of collective misunderstanding about what it really means to live with ADHD?
We have a lot of problems in that department. Like, uh, there is this we say theory that
Mm,
we had two type of brains from the past. They say the hunter brain and the farmer brain. So the hunter brain is the ADHD brain that it's always aware of every single change in the environment. So that's why it's become very distracted and noticing everything simultaneously. So
yeah,
that was a very well-functioning brain in the hunting era. But the farmer brain can be more patient, can tunnel vision through one single task for a long time and wouldn't get bored and all that. So the problem that we have today is that basically all the systems, the education system, the work system, everything is basically fundamentally built for farmers' brain. So they expect you to stay patient, to be able to tunnel
yeah,
vision for a single task for a long time. So just entering this world will cause shame. You don't have to do anything. Just experiencing a school, experiencing
yeah,
university, going into work, like any job, basically most jobs, will cause you shame because of how the systems are built. And we're maybe just now starting to maybe seeing that the systems are recognizing that not all brains function the same way, and maybe we have to make accommodate a little bit the way that we expect the task to be done, and maybe there will be a lot of time from now that we see real accommodations in most countries. But the way that we are seeing the environments right now, we probably we will see that they will, cause more shame than, be able to, help to ADHDers. And I think what I always tell to my clients is that we have to accept that the world is a very, nasty and dangerous place, and we can't really expect to see justice everywhere. So we have to emotionally accept that, injustice is way more common than justice in most places, in most systems in the society.
Yeah,
We should emotionally accept that, and we should not go in war with it. But if we see that somewhere, some people or some systems or some workplaces, all that, if they are recognizing the ADHD experience, if they are willing to accommodate for it, then we have to emotionally embrace that as well and be grateful that they are, accepting this sort of thing. I think right now it's probably a little better than maybe, I don't know, 10 years ago, 20 years ago. But
yeah,
still, we are seeing that, like, for example, in a place like LinkedIn, every once in a while, I can see a post or a policy from a workplace or something that they are causing more shame than anything for people like with ADHD or autism and stuff like that. I think that's understandable because I don't think someone without ADHD or autism can truly understand what
yeah,
how an ADHD or someone with autism can truly experience life. Like you don't understand the function, you can't understand the function, so it's really hard to for them to be able to accommodate. But what they can do is that to ask questions, to ask for help, like to even get help from maybe ADHDers and people with autism that, okay, what can we do like to improve our situation in work, in university, in school? What do you really need? These questions would be really great if they were ever asked, but if they don't ask it, I myself am fine with it, but I can understand that people, can take
yeah.
very negative emotions from this, and yeah, that's totally understandable.
I think clarifying is very, very important and not just assuming or taking face value of it. And I think we are also talking a lot about self-forgiveness here, Ahmadreza, right? Along with the self-forgiveness, it also comes, developing self-compassion. So do you think the self-forgiveness part plays a huge role when it comes to, the internalized shame that one carries when they have ADHD symptoms?
Yeah, I think we said that in research we say that the first line of treatment is medication. But I think in general, if we want to find one treatment tool or something that can really be helpful for everyone, it's this thing that you just mentioned. It's self-compassion or self-forgiveness. So I would say the first line of treatment is self-forgiveness. So when you are experiencing the symptoms, like for example, I start reading a book and my brain start causing distractions and going to fantasy or something like that. I can
Yeah,
go two routes, In one route, I can start to self-sabotage myself, like what's happening, why are you getting distracted? You have to, finish this book, you have to go this, you have to do this and that. This is one route, which is very awful, and it will cause more negative emotions that would make everything worse, and I would probably lose the chance to finish my task at that time. But the second route that I can go is that, okay, I'm starting to feel in distractions. I know the reason. I know that why it's happening. And I can say to myself, what's the problem? Like, I know this is my operating system. And I know that my operating system would have these, occasional distractions every once in a while. And if I don't make an emotional reaction to every distraction, then distractions will come and go like a wave. So if I disconnect myself emotionally, then I would probably continue reading that book for a long time and nothing would really happen that would hurt my performance. So if I can, get into a peaceful state for myself like this, then majority of the struggles that I'm experiencing with ADHD would probably end up fine. This is basically my own treatment plan for myself. So whenever something happens in terms of a symptom or a struggle, I'm just very fine with it. I'm saying like, okay, I know the reason is ADHD, so I just accept it in a very peaceful manner. In no sort of way I try to, bring up negative emotions because of ADHD symptoms. And that alone, that peaceful state, that self-forgiveness would solve the majority of the problems. There are some, minor details that can be added to this, but really the first and foremost, most important line of treatment is self-forgiveness. And when we start, therapy work, I always tell my clients that the most important thing that we have to do is that you emotionally accept ADHD. And this might take weeks, this might take months, but whenever that you have emotionally accepted the experience, we have done the majority of the work because then you will go into this pattern of self-forgiveness and being
Yeah,
self-compassionate toward yourself. And that will probably solve most of your problems. So that's the most important thing that we can do, this therapeutic work.
interesting. Okay, so let's do a very fun segment here. Okay, I'm just going to throw some common statements about ADHD at you, which we often hear, and you just tell me if they are myths or
Okay.
facts, and of course, you can explain why if you want to, right? So, the very first one is that ADHD is overdiagnosed. Is it a fact? Is it a myth? Or is it somewhere in between?
Well, yeah, I think it's a myth. And I think the reason that we are seeing the rise in diagnosis is mostly because of the failure of previous mental health professionals and clinicians. So if they hadn't failed to diagnose ADHD in the past, like most of these people would have received diagnosis and we wouldn't have any problem. Like the most important thing in this story is the prevalence rate. We haven't seen rise in prevalence rate, that the prevalence rate has stayed the same like since 20 years ago. So if we had an overdiagnosis phenomenon, that we would normally expect to see a rise in prevalence rate as well, but that just proves that we are just seeing probably the failure of clinicians.
Hmm. Okay. What about ADHD is just an excuse for laziness? Is that a fact or is it a Can you
Yeah,
hear me?
that's it's again a myth, and yeah, that's the easiest, path to go when you are seeing an ADHD behavior. But I will state this about this concept that a lazy person doesn't care.
Hmm.
They just don't do that thing, and then they're not upset or they don't have any negative feelings about it. But whenever I see a ADHD person that has failed to do something, they actually cared very much about doing that task, and they don't accomplish it. They are very upset, like they are killing themselves over it, and they have all these sorts of negative emotions because of it. So that itself, I think, proves to me that this person is not lazy. They just have something in their brain that doesn't help them with doing those
Yeah,
tasks.
yeah. I think people with ADHD want to get things done, but their brain works very differently. So the struggle is real,
Yeah,
and
exactly.
dismissing it as laziness only makes it harder for
Definitely.
them, I think. Yeah, I think the last one that I have for
Yeah,
you is
sure.
that only hyperactive people have ADHD. Is that a fact or a myth?
Yeah, definitely a myth. And we know that you can actually have a very calm personality and character, and you can still have ADHD. And we actually see this trend in women. Like most of the
Mm,
girls and women that I have seen received an ADHD diagnosis, they weren't hyperactive at all. So this is
mm,
actually one of the reasons, one of the misconceptions that is causing, missed diagnosis in girls, young girls and women. And this is why awareness matters a lot. We now today know that You can have a very high IQ and you can have ADHD. You can't be hyperactive at all, and you can have ADHD. So uh, the more we share awareness and talk about it, probably we can let go of this myth and stick to the facts.
Yeah, yeah. Like you rightly said, I think especially for adults, women um, experience it more internally, I think. That's why a lot of people, just go undiagnosed for
Yeah,
years because it's very internal then. Great. I think
definitely.
this, you were saying something, Ahmadreza.
No, no, I was just agreeing with you.
Okay, great. I was just saying that this has been
Yeah.
such an insightful conversation, and I think a lot of people will walk away from this not just informed but also feeling understood. But before we kind of wrap up, if there is one piece of advice you had give to someone who has recently been diagnosed with ADHD or is just feeling very confused about whether they have it, what would it be?
Um, that emotional journey that you have to go through to, accept and, come into peace with this diagnosis, that's the most important part of it. And if you can't do it on your own, it's totally fine. And you can, go and get help. Like, don't limit yourself or don't, ban yourself from receiving help from others because it's totally fine and it might even help you to find peace with yourself sooner. So just see what can work for you and do it. Like, do it and see what amazing things will happen in your life very soon.
Yeah, I think that's such a powerful message, and honestly, this is exactly why these conversations are so important. To remind people that they are not alone, and that ADHD isn't just a label but a different way of experiencing life, and that I think with the right support and understanding, they can thrive. And that's what I do understand. So, Ahmed Reza, this was such a great conversation. Thank you so much for sharing your insights so openly, your story, your personal journey. Um, I think this is going to help a lot of people who are either struggling with ADHD or newly diagnosed or just trying to understand it better. And for everyone listening, thank you so much for tuning in. If you found this conversation valuable, helpful, make sure to share it with someone who might need to hear it. Until next time, take care. Thank you.